Frankly, the principal debate in this referendum about health has been about whether the NHS will be sustainable in the long run or not. If we're in the single market, if we remain in the European Union, in my view, we are much more likely to have the kind of economic growth that allows us increasingly to support the NHS as we have an ageing population with all the demands that's placed on it.
Thinking about the impact of Brexit, I think first of all it's quite important to look at the current public finances and how stretched they are. Thinking particularly about health and social care, CIPFA's done some work looking at the likely shortfall in terms of funding by 2020, and we're predicting that that's anything between 8 and 15 billion shortfall, even after the efficiencies and the extra funding that's gone in.
In terms of the organisation or the funding or the structure of our National Health Service, there's nothing in European Union law that requires that to be organised or structured or funded in any particular way. Those decisions are national decisions under the division of competences in EU law between the European Union and its states. However, if sectors of the economy, including the National Health Service, are organised in a particular way, then it's possible for European Union law to apply to those sectors of the economy. So European Union free movement law, free trade law or competition law could apply to parts of a National Health Service if it's organised along market lines. And that has led to concerns about the ways in which European Union law could affect the NHS in England.
The European Union is not allowed under the treaties to interfere with our national health policies, and by and large it doesn't. But where the EU does have a responsibility, for example in helping us in making sure that we have safer food, better food labelling, deal with some of the risks like tobacco and alcohol, the EU has made some progress, but frankly could do more.
The free labour market and the ability for people to bring qualifications across the EU means that it's relatively easy for health and social care workers to work in the UK. So whilst the numbers are not massive, around about 5% in total of the workforce, there are real pressures on the NHS workforce and social care at the moment that mean that any changes are just going to add to the problems.
One of the best ways that we can protect people's health is to stop them getting ill in the first place. I mean, treating people is one thing, but actually if we can prevent people falling ill in the first place, that's of course a far better option. And one of the most important ways of doing that is to ensure people can live in a clean and healthy environment. And the truth is over the last 4 decades, we've consistently seen that the European Union has introduced legislation and directives that actually help improve our environment. The UK would be a far dirtier place if it wasn't for EU environmental laws, and those directly affect our health.
Our neighbours in Europe also share our values in terms of the National Health Service. So their health services are also based on dignity, based on solidarity, based on equality of access according to need. So the values and the principles of our health service are also encapsulated in the values and the principles of European Union health law, which is what you would expect.